Tinnitus symptoms and risk factors. Tinnitus is the perception of a noise or ringing in the ears. Tinnitus is a problem that affects about 1 in 5 persons. Tinnitus is not a disease in itself, it is a symptom of an undiagnosed disorder such as age-related hearing loss, an ear injury or a circulatory system disorder. Although annoying, tinnitus is usually not a sign of something serious. While it may worsen with age, in many people, tinnitus may improve with treatment. Sometimes, treating a detected root cause helps. Other treatments reduce or block the noise, which makes the tinnitus less noticeable. Symptoms of tinnitus. Tinnitus is an annoying sensation of hearing a sound when there is no external sound. Some of the imaginary noise types of tinnitus symptoms are as follows: ringing, buzzing, roaring, snaps, hissing. Imaginary noise can vary in pitch, from a low roar to a loud squeal, and can be heard in one or both ears. In some cases, the sound may be so loud that it may affect your ability to concentrate or hear a real sound. Tinnitus may be present all the time and it may likely be intermittent. There are 2 types of tinnitus. Subjective tinnitus is the ringing of ears that only you can hear. This is the most common type of tinnitus. The causes can be problems in the outer, middle or inner ear. It can also be caused by problems with the nerves of hearing or the part of the brain that interprets nerve signals as sound, auditory pathways. Objective tinnitus is the ringing in the ears that your doctor hears when he or she performs an examination. The cause of this rare type of tinnitus can be a problem with blood vessels, a disorder of the ossicles of the middle ear, or muscle contractions. When to consult a doctor. If you have tinnitus and it bothers you, consult your doctor. Ask your doctor if any of the following occurs. If tinnitus occurs after an upper respiratory infection, such as a cold, and does not improve in a week, consult your doctor as soon as possible. If the following occurs: if you have tinnitus and it occurred suddenly or for no apparent reason. You have hearing loss or dizziness in addition to tinnitus. Tinnitus causes many health conditions can cause or worsen tinnitus. In many cases, the exact cause is hardly found. A common cause of tinnitus is damage to cells in the inner ear. The tiny, delicate hairs, cilia, in the inner ear move according to the pressure of the sound waves. This causes the ear cells to emit an electrical signal through an ear nerve, auditory nerve, to the brain. The brain interprets these signals as sounds. If the inner ear's auditory cilia bend or break, they can cause electrical impulses to leak to the brain for no reason, causing tinnitus. Other causes of tinnitus include other hearing problems, chronic health disorders, and injuries or diseases that affect the nerves in the inner ear or auditory center of the brain. Frequent causes of tinnitus in many people. Tinnitus is due to one of the following disorders: age-related hearing loss. In many people, hearing worsens with age, and this usually begins around age 60. Hearing loss can cause tinnitus. The medical term for this type of hearing loss is presbycusis. Exposure to loud noises, such as those from heavy machinery, power saws, and firearms, are frequent sources of noise related to hearing loss. Portable musical devices, such as MP3 players or iPods, can also cause noise-related hearing loss if listened to at high volume for long periods of time. Tinnitus caused by short-term exposure, such as attending a noisy concert, usually disappears. Long-term exposure to loud sounds can cause permanent damage. Cerumen occlusion. Earwax protects the ear canal by blocking dirt and slowing the growth of bacteria. When too much earwax builds up, it can be very difficult to remove naturally, causing hearing loss or irritation of the eardrum membrane, and this, in turn, can lead to tinnitus. Changes in the chain of the ossicles of the ear. Stiffness of the middle ear ossicles chain, otosclerosis, can affect hearing and lead to tinnitus. This disorder, caused by abnormal growth of the ossicles, tends to run in families. Other common causes of tinnitus. Some of the less common causes of tinnitus include the following: Meniere's disease. Tinnitus may be an early indicator of Meniere's disease, a disorder of the inner ear that can cause abnormal pressure in the ear fluid. Head injuries or neck injuries. Trauma to the head or neck can affect the inner ear, auditory nerves, or the function of the brain linked to hearing. These injuries usually cause tinnitus in only one ear. Acoustic neuroma. This non-cancerous, benign tumor is generated in the cranial nerve that runs from the brain to the inner ear and controls balance and hearing. This disorder, also called vestibular schwannoma, usually causes tinnitus in only one ear. Blood vessel disorders linked to tinnitus. Rarely, tinnitus is due to a disorder of the blood vessels. This type of tinnitus is called pulsatile tinnitus. Some causes are as follows: atherosclerosis with age and with the accumulation of cholesterol and other deposits. The major blood vessels near the middle ear and inner ear lose some of their elasticity, the ability to bend or expand slightly with each heartbeat. This causes blood supply to become more energetic, which makes the ear detect the beats more easily. This type of tinnitus can usually be heard in both ears. Head and neck tumors: a tumor that puts pressure on the blood vessels in the head or neck, vascular neoplasia, can cause tinnitus and other symptoms. High blood pressure, hypertension and factors that increase blood pressure, such as stress, alcohol, and caffeine, can make tinnitus more noticeable. Turbulent blood flow: narrowing or twisting of an artery in the neck, carotid artery, or a vein in the neck, jugular vein, can cause turbulent, irregular blood supply, leading to tinnitus. Risk factors: anyone can get tinnitus, but the following factors can increase your risk. Exposure to loud noises: prolonged exposure to loud noise can damage the small cells in the auditory sensory cilia in the ear that transmit sound to the brain. People who work in noisy environments, such as factory and construction workers, musicians, and soldiers, are at greater risk. Age: as you get older, the amount of nerve fibers that work in your ears decreases, and this is likely to cause hearing problems that are usually related to tinnitus. Sex: men are more likely to have tinnitus. Smoking: people who smoke have a higher risk of developing tinnitus. Cardiovascular problems: disorders that affect blood supply, such as high blood pressure or narrowing of the arteries, atherosclerosis, may increase the risk of tinnitus. Complications: tinnitus can significantly affect the quality of life. While it affects people differently, if you have tinnitus you may feel the following: fatigue, stress, sleep problems, concentration problems, memory problems, depression, anxiety, and irritability. Treating these linked disorders may not directly affect tinnitus, but it can help you feel better.